Okay, why don't I get started? This is going to be chapter two and a little bit longer discussion here. And so last time we talked a little bit about the optimum criteria of healthcare, and we talked about it being finds the underlying cause or the basic cause, develops faith, confidence, and belief in the patient or the client, develops a remedy that is efficient, that is economical, and that's lasting. And so, kind of a philosophical discussion of how I got to the optimum criteria last time, but now I want to start showing you more about the clinical applications of this. There are three main phases to client management. Okay, the first phase is the investigation phase. The second phase is the intervention phase. And then the third phase is post-care, or what happens at home. And so I'm going to spend a little bit of time today, or majority, if not all of today, talking about the investigation phase. You know, what I meant by this, the lost art in the healing arts, patient history, is it's true. There's so much that you all tell me, and if I can just listen, then I can figure out where we need to go with things. I think that my experience in healthcare as a clinician has been, during my education, it was very, very, very important that I kind of followed the principles of chiropractic, right, as going through chiropractic school. And in terms of like the structural part of what's going on. And so the majority of my history, I would take questions about emotions, and I would take questions about like stress and like diet a little bit when I was in chiropractic school, but they really didn't emphasize that. It was like, where do you hurt? How long have you hurt? What's helping? What's making it worse? Point to it. And then, does it hurt to move? Looking at range of motion and more orthopedic stuff. And the chiropractic philosophy that I was taught was that a bone out of place somewhere in the body can be, or in the spine primarily, can be the cause of disease. And so, having kind of got to the end of my chiropractic schooling and going, okay, what else, right? Because if you recall, or if maybe you weren't on the last call, I was at the end of chiropractic school and I was doing an internship, and I saw all these people. This clinic was amazing in terms of chiropractic. They were seeing like 130 people a day. They were very efficient. A lot of, if not most of the patients there were very satisfied. They were there for about 3 minutes at a time. They were getting all of the bones in their spine that needed to be cracked and adjusted, and they were generally very happy. There was another segment that would get adjusted, and then it would come back pretty quickly by the time they were back to the front desk, or even in the car, or on the walk out to the car. And then there were people that the adjustment really wasn't doing a whole lot for, and not only that, but they felt like they'd seen 5 chiropractors and 4 PTs and 3, medical doctors that were like primary care, and then specialists in pain and neurology, and they'd seen all these different people, and they were kind of slipping through the cracks. So it was kind of around that time that I decided that I wanted to try to create a strategy that would help the people that are slipping through the cracks, because there were a lot of people already being served very well by the existing model of chiropractic that was out there. So part of that was to understand that I needed to let go of the idea that the chiropractic adjustment was the only tool that was available to people. And even though there are a lot of practitioners that are doing great work, that's the tool that they're using, for the people that were slipping through the cracks, they needed first an evaluation that had depth and that had more of a systems approach to figure out, well, what's actually going on first before we dive in with any particular therapy. So I'm going to talk a little bit about some of the different modalities or the different types of doctors that are out there today. And I'm going to use kind of an example based on the meme that was included in one of the newsletters for this. But basically, if we start thinking about what it is to be holistic, I remember my first business card. I was so proud. I was in North Dakota practicing in Fargo. Actually, my first business that I owned for myself was in Fargo. Had a short business in California before I moved back to Fargo for a couple of years. And my first business card, my business is called Triad of Health, based on the chemical, structural, and emotional factors that contribute to disease or dis-ease in a person's body. And it said holistic on it. And I was very, 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 very proud to say that I was a holistic practitioner, okay? And so basically, I remember then I was like going around town and I was seeing holistic here and I was seeing holistic here and I was seeing holistic there. And I remember flying to a seminar and I was sitting in the back of the plane, not in first class, but in the back of the plane, and not in business class, but in the very back of the plane, where I felt like an accordion the way my legs were folded up back there. And I was looking out the window and there was a truck that was loading airport food or like airline food into another plane. And it said gourmet on it. And I thought, oh gosh, a gourmet chef would probably be rolling over in their grave if they saw that the airplane food was now being called gourmet. So I realized kind of back then that holistic really didn't mean much. And, really, what does chiropractic neurology mean to people right now? And what does the Atlas method mean to people right now? And there's so much information today available to us, with social media. And there's so many people that are posting ideas online. There's never been a better time that I'm aware of to really be able to have access to information. And that's part of the issue, is there's so much information now that how do you actually make heads or tails of all this stuff? So what I'm going to start promoting here, or presenting, I should say, is my best attempt to try to organize things in a way that has a hierarchy of systems so that we know what to do and when, and we can understand what the variables are, be able to quantify those variables, so we can create a formula for success for each person that comes in here. And then basically it's like long division. And what I mean by that is we do an assessment where we identify the variables with history, and then we do an exam and diagnostics where we identify objectively what's going on with those variables. So let's say we have 10 different things. We have inflammation, infection, autoimmunity, gut dysbiosis, urinary tract infection, and like a peripheral neuropathy and a concussion. Okay, that's a lot of variables for one case. It's no wonder that this person's struggling to go into an office when they have like one or two maybe modalities, like a body work and maybe a dietary change, but they're not really addressing the concussion, they're not really addressing the infection, and so they just get caught in this loop, right? So how do we as clinicians like create a hierarchy so that we can do the right thing at the right time and the right amount? And how do we help people that are slipping through the cracks, that are in crisis mode? And then how do we help people that are wanting to do more than crisis mode and actually thrive? Okay, I want to share something with you. I think you saw this on the second newsletter we sent out for this event. But this is just a little bit more. I promise that I'm not going to be doing a lot of philosophy, okay, but this is just a little bit more about my philosophy. I had the distinct pleasure of being able to speak in front of a bunch of colleagues of mine and learn from colleagues of mine in France last week, or 2 weeks ago now. And this slide was shared by one of my colleagues, and Laurent Picard, and he's a French doctor. And this is a slide that he shared from the Global Wellness Institute from Dr. Jack Travis. But this is kind of a shift that I've made in my clinic, and some of you maybe who've been with me for a while kind of noticed when I made that shift. And I have to tell you, there are a lot of doctors working in this reactive medical paradigm, and they are completely burned out. Okay, it's a tough gig, and if you've noticed, you might have noticed, it's really tough to get into the doctor now. If you have a condition, it's just really hard to get in because there's more people that are needing help, and there are just seems to be less doctors available for various reasons. And for my own sake, I wanted to kind of move into a wellness paradigm. I definitely want to help people that are in crisis, but as much as I can, I want to transition them or help them transition to a wellness paradigm. And so you can kind of see some of the differences between the reactive and the proactive approach. The reactive approach, which is where most people present to my office, is they just want to feel better. okay, they have a problem and they'd like some help solving this problem and this pain point in their life, and they want to feel better, okay, versus they'd like to thrive, okay? They're kind of treating the symptoms. They'd like to be out of the symptom zones. They get back to their life. There are a few people in my office that want to thrive, but those are generally people that have come through the medical model and the paradigm of reaction to now wanting to thrive. You can see treat and cure illness. I can't actually treat a lot of conditions. I don't have a medical license to treat a lot of conditions. Sounds kind of funny because I see so many people that have a total variety of conditions all across the rainbow of different conditions, but I actually can't treat disease in my office. But what I can do is I can help actually people maintain and improve their health. So instead of focusing on their Lyme or their Hashimoto's or their GERD or whatever it is that's bothering them that doesn't seem to be responding to the other therapies that they've implemented or strategies, I'm more saying, hey, look, this is where you are. This is what healthy looks like. Let me help you identify some things to get you back to healthy, and I can help a person move towards health and physiological function rather than moving towards treating a disease. And so, that's a huge part of what I do. That's why I'm allowed to see so many different conditions. Now, as a chiropractic neurologist, I do have a specialty, and I'm allowed to treat people that have had concussions, and I'm allowed to evaluate neurodegenerative disorders, but technically I'm not allowed to treat those either. So it's kind of an interesting thing. Although I see a lot of people that have mild cognitive decline, and I work with them and those symptoms go away because their brain is now healthier, but it's because I'm maintaining and improving health, not because I'm treating disease. And this becomes so important because you'll understand that in the first phase of a care plan, I really need to investigate what's happening. But then the first question is, once I help somebody, it's like, how long does that last, doctor? How long does that last, okay? And so it only will last as long as the post-care aspect of their treatment or their intervention, and that will depend upon what needs to change at home, okay? Sometimes not a lot of things need to change. Often things do need to change. And so in that third phase of care, which I'm going to get into in another module in great detail, we need to really be focusing on that at the very beginning so that I can understand what needs to change when it gets to that point in their care plan. Corrective versus preventative. This is such a hard thing. I can't prove prevention, but I can say that, let's say a person has high inflammation in their labs, they have like something called CRP, they have high blood pressure, they have high hemoglobin A1C, which is a blood sugar marker, they have, if they're a guy, and they have high estrogen and low testosterone, and let's say we did a coronary calcium score and they had a high score. I mean, they're basically a ticking time bomb for a stroke, which is a common thing that takes men out, right? And so if I take that male and I work with him and his inflammation's off the table, that's normal, CRP is now normal, his blood pressure is now normal, his hemoglobin A1C is now normal, his estrogen is now normal, and his testosterone is now normal. And we're like, okay, even if he has a little bit of a higher coronary calcium score, we've taken 5 major variables off the table that are accelerating his risk factors. So although we can't prove prevention, we can say the things that are necessary to cause disease are no longer present. And so that's pretty darn good, okay? Episodic versus holistic, meaning I work on you when I see you as you have a problem versus I try to work with the entire whole of your system so you get a lasting change. Clinical responsibility versus individual responsibility. So this is something I run into all the time. A lot of people present to me with the kind of the attitude of, I'll see how it goes with this doctor, we'll see what this doctor can do for me, and I need to see these kind of changes in this amount of time. Otherwise, it's not going to be worth my time or my investment, which I get. But then there's the individual responsibility. So rather than making it my responsibility, it's really about my job is to help you identify what's actually a barrier to your goals and help you decide what's best for you. okay? Whether it's engaging in the therapies that I offer, whether it's doing a dietary thing or a supplement, but it's really up to you to implement all that stuff. And I really like this because this is what the optimum criteria talks about: develop faith, confidence, and belief, okay? Confidence in our plan, belief that I can work, and formulate a remedy that is economical, efficient, and lasting. And it only can be lasting if individuals are able to take that responsibility. Otherwise, they're just going to be stuck in this reactive mode, okay? And then the last thing is compartmentalized versus integrated into life. What good is it if you can like bend and twist and do things in my office, but then once you get back into life, you're not able to like load up the car? What good is it if you're constantly needing to see me for the same thing over and over and over again? I think there's some benefit to that if there's something in your body that has been injured and the tissue has been damaged to the point where it doesn't come back and you're needing constant support. That's fine, right? It's not like I'm saying if you need a cane, you shouldn't use a cane, okay? But it's more like what I'm looking for when I work with folks is how to help with that transformative process so they can have a lasting change and then not really need me anymore, okay? So things like just being upright, moving, eating properly for whatever that is for them, and engaging in their activities of daily living are essentially enough, and it's integrated into life so that their life and the tasks in their life are enough to reinforce it without having to do a lot of extra brain exercises and supplements and all the other stuff. So that's kind of where I'm coming from when I start thinking about how am I going to evaluate somebody. Okay. The other thing is I see so many cases that have seen a lot of different clinicians, and I'm not better than these clinicians, okay? But what I've done is I've created a model that allows me to investigate and be open-minded rather than having a clinic where I only have one or two things that I specialize in. I'm able to specialize in solving problems first and then figuring out what we do after we get a lay of the land. So one of the most helpful things that I do in my office, and I learned this from another colleague of mine, Datis Karazian. He practices down in Carlsbad in Southern California. He also has an institute called the Karazian Institute, which is open to both non-medical professionals and medical professionals. And it's one of the best places I think a person could go learn about more of a systems approach as it relates to labs and supplements for themselves. And then if you're a clinician, it's a wonderful place to learn that stuff. He wrote up this case review and he lets us use it, all right? It's not like he invented the questions, but he was able to kind of, he was ahead of me by several years in practice, and he figured out a way to do a history that was a lot more comprehensive than what was existing, to try to figure out how do we not fail from the very beginning? How do we not fail from the very beginning? And I can tell you one of the biggest ways to fail is to do a quick history that doesn't get enough information. Because if you're only looking at like one piece of data and you're addressing that thing that's in front of you, but you're missing 30 pieces of data, it's likely that even if you do get a change, it isn't going to be lasting because one of those other 29 variables is going to cause it to come back. And that's what's so frustrating for folks, is that they've seen so many people and yet they can't get a clear answer as to what's going on, and they can't get a clear program as to how to walk through that. Okay, and even here, like even when I show that to folks, it's so foreign, it almost looks weird to them and it doesn't make any sense. So that's part of the reason I'm doing these webinars, is so that I can now refer people to my process a little bit more so they can understand the depth and the thought process that goes into this, because I can't always get into this like during a new patient session, right? Okay, so if we start talking about the case review, and the forms, that's just something that is super, super, super helpful, especially if there's a lot of doctors that have already seen this person, because these doctors generally are very good at what they do, and they'll order testing or they'll do an exam. And I think of that, those tests and those results and that exam and those results, or the MRI and those results, even if the person hasn't been able to get to a level of function that they're satisfied with from these different evaluations, they don't have to start over. And each one of these bits of information is like a data point that becomes a bit of a larger piece of a puzzle. So a lot of people, the doctor was seeing one or two little data points and they're like, man, I can see that this is going on. I'm not sure what to do next. So then they'll send them to another specialist, and that specialist will look at one or two things and go, yeah, I can see these two little data points, but what I have to offer isn't really helping you. I'm not sure what to do next. Try psychiatry or try this. But what I found over the years is if I can get all these data points, it starts to look like a constellation instead of like a random star. And that constellation is visible and there's a pattern there, okay? And that pattern is something that I can point to, and then we can kind of fill in the gaps of that pattern with additional testing if need be. Or sometimes I'll look at all this information and it's like, wow, these doctors saw this doctor saw that, this doctor saw this doctor saw that, but none of them really saw the full picture because their philosophy only allows them to look at certain things. But I can see all these different pieces that these different doctors have ordered, and now I see a total picture of what's happening, and this is what we need to do. So I'm going to show you what that process looks like today. Some of you have gone through that with me. And then at the end, there will be a special offer around that. So I'm really excited to share that with you as well. So if you can hang into the very end, you'll get to see that. But let me just share something with you to kind of put things in context, okay? This was another piece of, this is another photo that I included in the newsletter if you got the newsletter. And so I almost feel like, I mean, when you look at this, you're like, okay, so doctor, I don't feel well, why? I'm not sure why I don't feel well, okay? And the doctor's like, well, I want you to meditate for 20 minutes twice a day, exercise for at least 30 minutes a day, avoid processed foods, eat plenty of organic fruits and vegetables, spend more time in nature and less time indoors, like AKA screen time, stop worrying about things you can't control, and ditch your TV, come back in 3 weeks. Right? And it's like, well, yeah, okay, sure. Okay, but like you have somebody who's got some significant stuff going on, and then they read something like this, okay? And it's like, well, yeah, that makes sense, right? So you have like these two different like polarized camps. One of these camps is like, okay, we gotta like get somebody in, do all these scans and do all these labs and then diagnose the small bits of this. It's kind of the reductionistic principle of medicine. And then you have this more holistic model, which is like, well, yeah, I mean, if you do things that nourish your brain, like meditate, and you exercise 30 minutes a day, which we all know exercise is so important, avoid processed foods, great, all this stuff, all sounds really good, but like, it's kind of insulting, don't you think, for somebody with a chronic issue to just be told to exercise for 30 minutes a day when they can barely get out of bed? To be told to meditate when they meditate and they go into anxiety about like the different things that are like threatening our existence, or if they're having a spiritual crisis and they're not sure about their soul, to tell them to start meditating and let their mind wander. So let's say this person followed the recommendation, okay? So I meditated for 20 minutes twice a day, but now I have insomnia and anxiety. I can't shut off my mind, okay? I exercised for 30 minutes a day, but I noticed after a week of that, I had trouble finishing my workouts. My old hip and back injury laid me up for 3 days. Okay, so they flared up their back and old hip injury. I've been avoiding processed foods, but I'm not sure what to eat and how and now I'm getting anxious and brain foggy between meals. Okay, so we'll talk about what that means. And when I eat more organic vegetables, I get incredibly bloated and I only poop every 3 days instead of 2 times a day from the vegetables, okay? I've never been constipated in my life. I was spending more time outdoors, but between the wildfire smoke and the allergy to pollen, I can barely breathe through my nose now, okay? Which has also influenced my sleep. I've stopped watching TV, but during meditation, my mind continually goes to the worst possible political outcome that I want. I start worrying about my family with everything that's going on in the world and climate change, and I don't know how to turn it off. My mind rumination might as well be worse than the news. The same things are on my mind when I go to bed 2 hours earlier since I'm not watching TV, but now I just lie awake and I worry. I followed your advice to the letter and I've never felt worse. And this is the thing. What is a healthy diet? Like, what is healthy exercise? What type of meditation is this person doing? And why did they respond this way? Okay. okay? So I think patients are kind of tired of not knowing where to turn. They're tired of being dismissed. But like these type of tropes about like these things, like if you just live a healthy lifestyle, then you'd be healthy. For somebody that's in crisis, it's not gonna work. Okay, it just doesn't work. And I almost feel like people that post these memes, maybe like if you're not a medical professional and you post something like this, fine, okay? But if you're a medical professional and you see patients for a living, I don't know how you can post something like this. It's almost like you've never seen a patient in your life and you've never understood like how dangerous it is for somebody, for example, with SIBO, small intestine bacterial overgrowth, to eat a bunch of vegetables, ruin their small intestine so they can't absorb food, go into stress chemistry and basically exacerbate all of their autoimmunity if they have it, or inability to fight the infection or the Lyme that they're already dealing with. So I'm not doing this to lecture doctors, okay, but I'm just saying like when I read something like this, if it's posted by a doctor, I almost wonder if they see clients. I wonder, okay? The cool thing about living in the information age is that we have more access to this stuff. The not cool thing is like it can be overwhelming and you can almost feel more isolated and more lost because you have people like on Instagram who are completely yoked and like in great shape and fit talking about keto. And then you have people that are ill that want to be yoked and they want to be like in great shape and ripped that okay, this person did keto, so I'm going to do it work for this person. And then it doesn't work out for them, or they get sick from it for various reasons. And then they give up on it, they lose hope as if they can't actually do those things. And then when they talk to a doctor and that doctor starts talking about keto, they're like, oh, keto didn't work for me, so I can't do that. This doctor doesn't really, isn't going to be able to help me. But instead of going, keto doesn't work for me, we have to go, why didn't keto work for that person? What symptoms did they get? Did they get brain fog from keto? Okay, if they got brain fog from keto, is it because they're not absorbing fat and they went into an energy crisis and their old concussion got flared up from that? If they got brain fog from keto, is it because the malabsorption from fat, was it coming from the small intestine because they have SIBO? Was it coming from the gallbladder because they have like gallstones, or they have a gallbladder issue, or they have a problem activating their gallbladder because they have a stomach problem? Did they have a problem with keto because they were absorbing the fat, but they were eating too much saturated fat, even coconut oil, and that saturated fat was triggering their old concussion? Did they have like clay-colored stool? Did they start getting gas? What was going on? Do they have a microbiome issue where they're feeding the microbiome with this fat and they're creating inflammation in the bowel instead of helping them? So every time I talk to somebody and I go, what have you tried? And they start to tell me what they tried, I actually have to walk through that with them to help them understand why that didn't work. But I can only do that if I have an actual picture of what's going on with them. If I'm only looking at keto and only looking at that didn't work, what window do I actually have to offer them anything? Okay, so this idea of a systems approach, a comprehensive assessment at the very beginning becomes so important, okay? But like, if we take this case here, for example, and we go, okay, like what's actually happening here? Okay, what's actually happening? If this person has walked into the medical doctor's office and let's say their symptoms were acid reflux, okay? So they go into the medical doctor's office and the doctor says, okay, if you're having acid reflux and you're having bloating, we could try an acid blocking medication and we'll see how that goes. Okay, they're like, okay, I'll try that. So they try the acid blocking medication and it works, okay? But the problem with acid blocking medication is it blocks the acid production, which could be irritating the lining of the stomach, which is helpful, but then the person isn't digesting food anymore. So the long and short of that is later on that those undigested food proteins can become targets to the immune system, and it can actually be promoting autoimmune problems. And it can be promoting dysbiosis because you're not digesting your food properly, and all that undigested food, although it's not acidic anymore, it's now going into your intestines And your bacteria, there's 100 bacteria for every cell in our body, and those bacteria in our bowel are basically eating the undigested food and they're having a party. So that's what like bloating and gas is in many cases. So they're helping them with the key symptom, which is going back to that reactive approach, which is symptom management. But unfortunately, they could be creating a problem later on in life for that person. And then now they have to go back later for these other problems. And if you see a GI specialist and they're focused on the stomach, that might be a different GI specialist who's focusing on your large intestine. So even within the specialties, there might be some issues figuring that out, okay? If you go see a functional medicine doctor, okay, who is looking more at physiological problems causing acid reflux, they might go, okay, let's run some labs and see what's going on affecting your stomach. But generally what this is it's not too much stomach acid, even though the acid blocker worked. It's not enough stomach acid. So what's happening is in many cases the food's going in, it's not digesting fully, and that undigested food is putrefying in your stomach, which is causing a different kind of acid, which is irritating the lining of your stomach. Your stomach actually likes the hydrochloric acid it makes, but it doesn't like this putrefied food because rotted food is not really healthy. It's fermenting in your stomach. So then it gives you the signal of acid reflux to say, hey, something's wrong here. Okay. And so it's not like we're just trying to undo that with Tums or undo that with like a stronger medication. So the answer then might be in that office to do something like apple cider vinegar to help the stomach lining a little bit, or something like hydrochloric acid or a digestive enzyme to help break down that food so that it can be broken down and go into the small intestine and then not create a bunch of problems. Okay, so those two cases, one is the more standard approach. It's not wrong to do it that way, okay, but there's some pitfalls there. And the other approach is more of a functional approach, which is to say, yeah, okay, we correctly identify that there's hypochlorhydria, which is low stomach acid production. So here's the digestive enzyme. Okay, and then, but what did we actually accomplish? We accomplished a reactive intervention where we helped that person get out of the symptom phase. But did anybody ask the question, really, why does this person have low stomach acid? Why does this person have any acid that's irritating the lining of the intestine? So like there's kind of this moral high ground that some doctors that are not medical doctors take. Like there's like medical doctors is kind of a tough gig, right? And so like you got all these other doctors that are taking this moral high ground, like we're getting to the underlying cause, we're holistic. But then, I don't know, are we getting to the underlying cause when we give somebody digestive enzymes and don't actually address the underlying mechanisms, or at least assess why this person's having low stomach acid? So if we took like 3 cases, okay, I've definitely had a case where like I had this guy who's more of a bodybuilder kind of guy come in and he started getting acid reflux. And I took a deep history, and he was getting acid reflux because he was one of these guys that was walking around carrying like a gallon of water because he wanted to stay hydrated, because he's trying to hydrate his muscles and get like yoked and get big. And so he was walking around with like a gallon jug of water, and he actually brought it in my office. And I'm like, okay, well, how long have you been doing that? And he said, well, about 6 months. I said, well, when did you start getting acid reflux? About 6 months ago. Okay, and so for him, he was just diluting his stomach acid so much that the food was not digesting, and it was putrefying, and it was causing all these symptoms. I mean, look, acid reflux is no joke. You can get Barrett's esophagus and get cancer and die from it. It's not like something we just want to dismiss. But in this case, like there was no like brain therapies we needed to do. There was no special diet that we needed to do. There wasn't a lot of labs that we needed to run. He just needed to like engage in better macro nutrition, which is like not combine too many liquids with your solids, and let his body digest normally. Okay, but I wasn't the first doctor he saw. He'd already done the digestive enzymes. He'd already done the acid blockers, and he was still looking for answers. So for him, that was pretty straightforward, okay? But let's say another case comes in, and you're like, okay, when did this start? Okay, and it's like, it started about 6 months ago. Okay, what were you doing 6 months ago? I visited my relatives in the Midwest. Okay, and what did you do when you were there? Well, I actually was helping, we built a new chicken pen and I was helping wrangle all these chickens and I was spending quite a bit of time doing that and I was around, I was helping like pick eggs and all this stuff. And it's like, that wasn't the first thing they told me, okay? But it was obvious they had gone home. I said, well, what did you do in your home? And they mentioned that, all right? And that was just like in the background. And then we talked some more and I'm like, okay, it looks like based on your forms that you have low stomach acid production. It seems like this started on your trip home. How did that go? Did you fall and hit your head? Was it stressful? Were you dealing with a parent that now has dementia and you're having to put them somewhere? Like what's going on? And they said, no, it was a great time. I had a lot of fun. In fact, I had a great time working with my brothers and my uncles. We built this chicken coop and da 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 da. And I was like, okay, it was standing out to me that this person had exposure to a lot of chicken and eggs. And as you may or may not know, many chickens are infected with an organism called H. pylori. Okay, so he also had to fly home, and it was an early flight, and so the flight was also stressful. There was turbulence on the flight, so he kind of got there in a state where he was a little bit stressed out in terms of the flight, and he was a little bit sleep deprived. And then he's now working around a bunch of organisms that basically were infected with H. pylori, and so he was exposed to it, and he got H. pylori. Now, H. pylori is a infection that's supposed to be not an infection. It's a normal bacteria that lives in our stomach, but it can overgrow, and there's different strains that can be more pathogenic than others. And so this individual had a hypochlorhydria and acid reflux, not from drinking too much water with meals, but because he got infected with a bug called H. pylori. And that H. pylori was burrowing into the lining of the stomach, and burrowing into the lining of the stomach was damaging the acid-producing cells in the stomach called parietal cells, and he wasn't able to make as much stomach acid as a result of that because of the inflammation in his stomach, and he was actually starting to get ulcers from it. And so this individual just needed to work with somebody that could help them with the H. pylori. And so there's supplement ways to do that, which generally take much longer. And then there are antibiotic ways to do that, which generally go faster. And then now there's different probiotics that a person can take that can be helpful with that. So you can see that even if both these people were like 35-year-old bodybuilders, one of them had a problem where they were drinking too much water, trying to get hydrated. The other person had a problem where they had a stomach acid issue secondary to an infection. But both of them might go to the doctor and end up on an acid blocking medication, or they might go to the doctor and end up on digestive enzymes. The person with H. pylori, when they get put on digestive enzymes, because they have irritation of the lining of their stomach and ulceration, often they do poorly on hydrochloric acid supplementation. So that would be another indication in the history, like, well, what have you tried? Well, I saw another doctor, they told me I wasn't making enough stomach acid, and they put me on enzymes for that, and they burned my stomach immediately. Then I already kind of know they probably have an ulcer, and it's probably something that's damaging the lining of the stomach, either lack of blood flow, hypothyroidism, secondary hypothyroidism, lack of stimulation from the vagal nerve, an overgrowth of an infection, autoimmunity, something like that, okay? So you can see how you start walking through a history, and it's not so simple, okay? It's not so simple. This person, if they were just told to eat less processed foods, if they have a stomach acid issue, they're gonna eat like more like lean meats and veggies, and they don't have the stomach acid to break that down. So that's not gonna go very well for that person. That person actually would do a little bit better on a higher carb diet in the short term while they don't have the stomach acid to let their gut heal. So it's just like, I understand the, how do you say, I understand what they're trying to do with that meme, but I just feel like it's so much more complicated that it's insulting to people that have complex issues to just say it's that simple. And if you're sitting here with a complex issue and you felt that before, just so you know, I understand. I got you. Okay, we got this. And there is information out there that can be helpful. And I can tell you that the process of recovery looks a lot different than a process of reaction and getting out of symptom phases. And sometimes, if you've had things for 10 years, 5 years, 3 years, 15, 20 years, the process of recovery is different, okay? It can take quite a while. It can take quite a while of doing different things with lifestyle, and quite a while of doing the right supplements and the right food plan, and quite a bit of the right modalities and a mindset that works for you to actually get to that level where your body thinks it's okay to start healing instead of stuck in inflammation and crisis mode. And we're going to talk a little bit more about this during the case review part of this webinar, but it's like the hardest part for me as a clinician is like getting enough time to allow nature to take its course. And really, a lot of people, when they come in, they expect I'm going to fix them, and they're not broken. Their body actually thinks it's appropriate for them to have what symptom they have. Now, certainly there are genetic things where, like, you know, people can have blindness genetically. Okay, so that system is not available to them, but it's still not right to say that they're broken. Okay, we could say that they don't have that system available to us. And so if they don't have access to that system, what systems do they have available that we can utilize to help them function better? Because, you know, blindness will affect your occipital cortex. Your occipital cortex does play a role in different things, even related to the immune system. And so we want to try to account for that by letting another system take over or compensate for that. So that's part of my job that I'm going to get into in the exam module when I talk about exam and diagnostics, is to go, okay, I see a symptom, I can correlate that with an exam finding. Is it appropriate for this person to have that exam finding? So do I want to reinforce that? Or is it inappropriate? Do I want to help them shift into a different mode of function? So for example, if they're in fight or flight all the time, is that appropriate if they're in an abusive relationship? Is that appropriate if they have significant inflammation in their body from an infection? Or is it they're stuck there, they have dysautonomia, and I need to help that calm down? And so again, like the history becomes so important, because if we're just trying to stop a symptom, then we could be stopping a body's adaptation, which can actually weaken the person, and it's no wonder they're not getting better, because they're using that inflammation as an adaptation to help them try to get to a place of recovery, and we're actually stopping that. Does that make sense? It's a little harder to talk to a camera sometimes without any feedback, so if I'm going too fast, I'll try to slow down. Okay, yeah, Hollis, I was trying to share screen on that, just to kind of keep coming back to that example. But thank you for letting me know. That same person with acid reflux, you could talk to them and they could be like, well, when did this start? It started 6 months ago. Okay, what happened 6 months ago? And there's like really nothing major that was going on 6 months ago, other than 3 months before that, they had COVID. Okay, and you know, COVID just caused a number of things in their body, and they lost the ability to compensate, and now they had acid reflux. So I could literally go through thousands of cases of acid reflux and show you how each case is different. And there's a standard model way of approaching that, which is to do acid blocking medication. If that doesn't work, then to do a GI study where they look at the stomach. They might even biopsy the stomach, or do like a endoscopy from the top down, or they could do a colonoscopy from the bottom up, and they try to get a picture of what's going on. And even if they find something there, they're localizing it to that one system. So the question is, even if you see an ulcer, like, why is that ulcer there? If it's not something easy to treat like an infection, then like what's actually causing the problem, so that we can get a lasting change. So that's like that philosophical approach of transformation that I just want to keep hammering. Okay, so if we start talking about what an actual history looks like, okay, and like how not to fail from the very beginning. Some of you here are actually clients of mine, and so you know that I haven't done a case review with all of you. I don't do a case review with every person that I see, because not every person is presenting with like super complex issues and have seen like 30 doctors and has like 500 or 600 pages of labs to go through. Some of you have still pretty significant issues, but you haven't seen enough doctors to warrant a case review. Or when I do my consult with you at the very beginning, it doesn't sound complex enough from my perspective to need a case review. And so we'll just do like a basic questionnaire. Okay, but let me just run through the case review so you can kind of see this is my best approach to try to solve the problem where all these people are slipping through the cracks, okay? Of course, Adobe is telling me I need to log in to look at this, so give me 1 second. And see if I got the password right. Lucky. Okay, looks like I got the password right. And let's sign out of here. Okay. So basically, this case review is a really detailed history, because here's how it works. Let me just give an overview. In order to help people that have complex issues that are slipping through the cracks, you need to be able to be cross-trained, you need to be able to be open-minded, you need to be able to ask questions, and you need to have somebody that's willing to collaborate with you and willing to try stuff. Okay? And the first step is really a history. Now, the goal is to ask questions, get an idea of where the problems are, and then have forms to kind of start to do the subjectivity of where the problems are to correlate with the history questions, and then have objective data in the form of labs or exam findings or diagnostics to qualify and quantify specifically the degree at which these symptoms are correlated with something tangible, and then have a strategy that addresses the objective core base physiological problem that's the core hierarchical situation that's going to get the greatest effect on all of the downstream systems. And I have to tell you, I'm going to talk about this a lot next time, but gravity is a stimulus that we have a core system in our body that's supposed to facilitate gravity and harness it and use it to stimulate our brain. And when we have gravity problems like vertigo, motion sickness, dizziness upon standing, significant fatigue, heart palpitations upon standing, when you have these things going on, there's a gravity stress that's like happening 24/7, and that can perpetuate so many problems. So I'm going to get more into diagnostics and exam next time, but that becomes really important in the history process. So let me show you my case review. Okay, so I start out with questions related to, hey, how old are you? What's your education? And did you do sports? And what do you do for a living? And what's your hobbies? Because some professions are more left-brained, some professions are more right-brained, some professions are more seated. Some professions have a higher risk associated with like chemical exposures, that kind of stuff. So like there's people back in the Midwest where I grew up, there's a lot of people that are getting lymphoma from, we're thinking maybe from Roundup, okay? I'm not trying to get sued by the people that do Roundup, but there is a class action lawsuit. I don't know if it's been proven or not, but people that are farming are exposed to a lot of different chemicals. And so when I asked your profession, that's kind of what I'm trying to figure out. And then sports is so important because it's like if you played football, if you played soccer, if you rung your bell a few times playing rugby, that's pretty significant in terms of a lot of people have old concussions, or they had their bell rung, they didn't even consider that a concussion, or they had a whiplash. And those things created a permanent change in the glial cells in their brain. I'm going to do a whole module on neuroinflammation later on, but basically neuroinflammation, just a quick view of that. If you don't do well with alcohol, if you don't do well with lack of sleep, if you don't do well with stress, like you fall apart now and you never used to, if certain foods are triggering you into brain fog, and if like exertion like knocks you out, then there might, especially with brain fog, there might be a probability that you have an old concussion or a trauma, like a severe psychological trauma or severe infection that changed the immune cells in your brain, which make up about 98% of your brain. So when I ask about sports, I'm kind of wondering, I wonder if this person had any evidence or history of concussion. just right off the bat. That's how I started thinking. List your orders of chief complaints in order of importance, right? So obviously I want to know why people are presenting to my office. Most people don't write, I want to thrive in here, but I do see that once or twice a year, and that's pretty cool. Generally, they're not doing a case review, so they tell me in other ways. But basically, I kind of want to know what's bugging them, but also in order of importance, so that I can formulate a message that makes more sense to them in order of their priority. Because I might see some things that aren't related to their priority that are actually driving their priority, so I want to make that connection for them. Okay, so give me a detailed narrative. This is where I've had people give me like a 20-page document of like ever since they were a kid, they were born, their mom had problems during pregnancy, had like the flu, and their mom was going through a divorce or something. The child was born cesarean, was in the ER or ICU and had all these issues as a child, and so yada yada yada. It can go all the way from infant to where they are now. Now, from my perspective, I just want to share something with you that most clients and patients don't think about, is that, like, let's say you're a 27-year-old female with severe like period pain, okay, and you've been on birth control for 10 years to try to control that, and it's helping a little bit, okay. I've seen, likely, now being in practice for 20 years, I've seen a 50-year-old woman who had a similar presentation to you at 27. I might have seen that person right before I saw you. And I did a case review with them, and their case review looks exactly like yours, except for theirs goes all the way to 50 and doesn't stop at 27. And so, like, I have this perspective of like what can happen when people aren't able or willing or open, or for whatever reason are unable to make changes that are necessary. Maybe they don't have the resources financially to make the changes. And believe me, I'm super motivated to do everything I can to try to help you avoid turning into the woman that I saw right before you that has all these problems that stem from before they were in their 20s, but just weren't able to address them. So the perspective I have when I'm talking to you and these different timelines that you have, I don't really have a pen anymore, but sometimes I just kind of want to drop my pen when I hear some of the things you say, because they're so significant, and we just got to make sure that we don't lose sight of those things, okay? And we don't lose sight of that there's problems you're dealing with now, and then there's consequences to not dealing with them now. And those consequences can be dire. And I'm not like a doom or gloom guy. You probably know that about me if you're one of my patients or clients, but I don't want to scare you, but I also at the same time can't, I try not to sugarcoat things too. You may have noticed that, okay? But like the reality is we get one life in this body, and based on your belief about what happens when we die, I think there is something about my practice that's a spiritual practice, because if I can help you feel better in this body, it might affect your decisions in this life, and it might affect what happens when you pass away, or maybe it won't, depending on your belief system. Maybe you don't believe that, but these timelines become so important. And I can tell you, I learned so much about your case when I see these timelines, okay? Basically, the way it goes is somewhere in that timeline, a person will tell me, I was never the same after this event. And it was some sort of like infection, like food poisoning. It was some sort of like flu, or in many cases COVID, a lot of cases vaccines. It was a blow to the head. It was the loss of a spouse. It was something significant. It was graduate school, okay? And I can tell you, when I see that, and there's a clear, when this whole thing started, okay, that often looks like autoimmunity, okay? The body just lost its resiliency. It lost its ability to go from homeostatic mechanism to being off kilter, and allostasis was not available. It just was overcome. They couldn't get back to homeostasis. So I see this all the time, and it's often some sort of autoimmune issue or some sort of infectious disease like Lyme that is finding a comfortable host to flare up on. And so we need to address those things. Okay, list me the diagnosis that you've been given. These diagnoses are super important. I generally think that most doctors do a really good job in their field, or at least are average in their field, which means there's a standard that they can hit. And so I like these diagnoses. To me, the diagnosis is telling me where the problem is. There's a constellation of symptoms. My job is to figure out why it is the body think that's appropriate, and then help them, if they have a goal of not having those symptoms, help it make it appropriate for their body to feel safe not to have those symptoms anymore, or feel like that's appropriate. Okay? List your opinion of what you think has happened to your health. Okay? Most people in this question will tell me pretty close to what's going on, but like most of their doctors just didn't believe them. Okay? They'll talk to doctors and they'll get sent to psychiatry because their doctor that they saw just didn't have the ability to see enough of the data points to make sense of it. Okay? And so imagine they see a couple of data points and they can't understand why that is. They may start to think it's in the person's head, okay, because they're just not looking at enough data points. And it's because their model doesn't allow them to look at enough data points, or because their model has them focused on one thing, and then if they don't see that, they refer to the other person, and that other person within that model sees a couple of things, but they don't have enough to figure it out, and nobody's looking at the big picture like we talked about before, okay? But most people kind of know when that pivot point was in their life, okay? List all the healthcare providers you have consulted, okay? And so this is kind of cool. I get to see all the specialists they've seen, what their diagnoses were, and then also what their opinion was. So meaning, what was your opinion about what this doctor had to say about your case? A lot of times I see that they're in agreement. They tried some things that didn't work out. A lot of times I see that they were not in agreement. A lot of people with chronic issues are sent to psychiatry. They're told they just have anxiety or they're just depressed. And they do have anxiety and they are depressed because they don't feel well and nobody can figure it out. And I think that doctor is probably trying to help them by giving them something that can kind of control those emotions, but they kind of disagree that it's in their head, right? It's probably not just in their head. It's a physiological problem for a lot of folks. And so I see a lot of people that disagree with the diagnosis because oftentimes they're told it's in their head. Okay, this is where they get to list everything that worked for them. I can tell you, these are some of my favorite things because they're like, oh man, I had this one doctor that put me on this one thing, and like, let's say it was a probiotic or medication, and like I understand the mechanism of that probiotic and I understand the mechanism of that medication, and I'm like, it works so well for me, but my insurance changed and I can't take that medication anymore, or it just stopped working for me. And now I don't know what to do. And so imagine like wouldn't it be cool like if everything was a one-step process in life? Wouldn't life be so much different? But like if you're working on a Rubik's Cube, okay, and you're like, okay, I got one side blue, now I need to get the other sides to match. It's like, it's a process to go through that. And for the life of me, I suck at Rubik's Cubes, but I'm pretty good at figuring out like medical mysteries. And if like you took like a medication and it worked for a while, then it stopped working, what it probably means is it worked on one side of the Rubik's Cube, but it was kind of like working with your adaptation, but your body needed that adaptation. And so now it's using the other sides to continue to adapt. So it's almost like you weakened your adaptation. And so now you're like more severe in these other areas. So now we need to like go figure out why your body needs to do that. I also see that if things worked for a while, then they stop working. So for example, somebody took some herbs that kill stuff in the intestines. So your acid reflux went away after you took something that killed H. pylori, or your SIBO went away when you took herbs that kill an overgrowth, or your sinus infection went away when you took an antibiotic, and then after a while it came back and the same thing works every time. That might be an indication that you have a biofilm. I'm going to do a whole module later on about biofilms, but the idea is if you can understand what worked for that person, but then also understand why it didn't last, that's like the next step in that wellness model. Like, let's see if we can make them integrate this into your life so it's a lasting change, okay? It's the same thing here. List any medications or supplements that have caused reactions that decrease your health. Oh man, when I give something to somebody and it doesn't work out, what I learn from that becomes like the crucible by which we forged a new pathway. Sometimes despite a case review, despite like hours and hours of discussion, expensive labs, we decide to try something, and the thing that we try surprises us with its reaction. And what we learn from that will almost like become another diagnostic criterion. So a supplement or an intervention generally is supposed to help, okay? If those things don't help, and worse yet, there's a symptom that comes from that, then it's almost like it's not just therapeutic, it can be diagnostic. And what we learn from that becomes a major breakthrough. But if a person is stuck in the reactive mindset of we'll see how it goes, and they're spending out of pocket on things, and they're like, I can't afford to feel worse right now, I need to feel better, then they might abort a process that actually could help them figure out what the next step is. And then I'll just see like a list of these things. They've seen like this doctor tried this doctor tried that, this doctor tried this. And the things that made them worse, actually, that doctor, if the patient stuck around, might be able to figure out why that is and help them resolve it. But if the doctor hasn't developed faith, confidence, and belief, then the patient's just going to bounce. And I understand why a patient would bounce, okay? But I get to read all this stuff, so I get to be kind of like armchair quarterback in a way and go, okay, this is why this didn't work, this is why that didn't work. And I can tell you, it's so nice to be able to walk through that with somebody. And also, like, if it's something that I would recommend, I'd be like, this didn't work because it was step one for this particular intervention. And in step 3, this can be amazing for you, okay? But it didn't work in step 1. So it can be super, super, super helpful. I like to look at the medications that people have taken and which ones they've stopped. Again, did they stop it because they ran out? Did they stop because they got better from it and it resolved? Did they stop because they had bad reaction to it? Did they stop because their insurance changed and now they're feeling terrible from it? And what was the reaction? How long did it last? Some people just have like an immune reaction to medication. Sometimes the medication side effects were just too bad. Sometimes the medication did exactly what it was supposed to do, but it decompensated the system, and so they did worse. So that's something that I have to figure out, okay? Can you see how I might not be able to figure that out on like a 15-minute time slot for history? Okay, let's timeline sequence any significant laboratory or imaging results. So again, people come in with MRIs, they come in with GI endoscopies, they come in with CT scans, they come in with x-rays, they come in with angiograms, which looks at their blood vessels, they come in with like nerve velocity studies and muscle strength studies, they come in with different types of biopsies and different diagnoses of cancer and dysautonomias. And look, if I see something there where there's an ablative lesion, meaning that area of the body is gone and we can no longer count on it, and then I start telling people that we can count on it and we can get it back, I've really done a huge disservice. And it's really more than a disservice, it's just untrue. So I like to look at all that stuff to make sure that I'm not promising the wrong thing. And again, like, people really like to know that all their data points have been looked at and they're not starting from square one and they're making use of all that time and money investment in these diagnostics. This is one of my favorite questions here. List the timeline sequence any exposure to environmental, industrial, or toxic compounds. I can't tell you how many people put none on here. Even out here in California where I live, people put none. And like, we have months of wildfire smoke seemingly every year now. Last year was a little bit better. Since about 2016. If you're indoors during the pandemic and you had a stove that had like a gas stove and you're just indoors a lot, that's another thing. All the stuff in your new car that's off-gassing, all the stuff in your new clothes that make you itchy if you don't wash before you wear them, plastics. I mean, your water, if you're not filtering it, gosh, Romeo, oh Romeo, how do I love thee, let me count the ways. I mean, how many different ways are we getting chemical exposures? These chemical exposures act as endocrine disruptors. They polarize the immune system into autoimmunity. They create all sorts of problems. Things like coffee, which is not organic, right, has a lot of toxins in it. Things that are sweetened have more toxins in it. Things that are cooked on aluminum, heated on aluminum, non-stick stuff. I mean, there's just so many things. And again, I'm not a doom or gloom guy, but I have to understand if they write no here and later on in their forms, they actually show chemical sensitivity, I need to figure out where that's coming from. Otherwise, I'm going to fail in their case. Okay. And then I talk to people who are like welders. I talk to people who are farmers. I talk to people who worked in retail and they were exposed to all the dry cleaning chemicals all the time. I talk to mechanics. I talk to people that work in a building that was diagnosed as moldy. So yeah, these environmental compounds really matter, like dentists. There's a reason why dentists, I think, are one of the highest rates of suicide. And they just have an incredible amount of off-gassing and exposure every day when they're doing this stuff. They do their best to try to counteract that. List any history of infections, excluding common colds. So like number one thing here is like strep. Strep is nasty. Strep, a lot of people have had strep. So these infections are interesting because not only are they problems if they're living in your body, but they can start to look like your own tissue. So imagine you have strep in your body and your body thinks strep and dopamine are the same thing. You can start attacking parts of your brain because it thinks it's strep. So I see kids with like pediatric acquired neuropsychiatric disorder. They got strep and all of a sudden they started screaming and getting tics, and they had an autoimmunity that was caused by a strep infection. So many people will tell me that they had got bit by a tick, and then that was one of the biggest pivot points in their life. So these infections are super important, not just because the infections themselves cause problems, but because the immune response to the infections can become overzealous and they can cause tissue damage and autoimmunity. And the antibodies that are supposed to help us find and kill these infections can bind to healthy tissue and also to foods that can cause food reactions, okay? Super important. How many head injuries have you had? Many of you have seen the paper attached to your chart about how an old brain injury can be the cause of your current problem. I don't want to spend too much time on this. I'm going to spend a whole module on neuroinflammation and head injuries and how they affect your quality of life. But needless to say, if you've had like a head injury as a child, like me, I was dropped on my head when I was a kid. My brother's really good at reminding me of that. And so I was dropped on my head on concrete when I was a kid. I also almost drowned. I fell into a pool and almost drowned when I was a kid, which is another type of brain injury. And so my brain doesn't handle certain foods well. My brain doesn't handle certain types of stress well. My brain doesn't handle lack of sleep well. And so it's kind of clear that I can inflame my brain, and my brain is more vulnerable because I've had these old injuries. Okay, I even had autoimmunity to my brain secondary to strep, like one of the cases I was talking about. So it's like these old whiplash and head injuries are very significant if you've had them. So if you had a scar on your chin like I do, or a scar on your head like I do, it's really significant, especially if you have brain fog or like things just aren't getting better. This is another good question that Dr. Kreising came up with. Are you emotionally capable of handling more treatment? Most people will say yes. I'm not sure. I think they mean well when they say yes, but it becomes a little not straightforward when you start talking about the level of changes that might be required in order to get to that healing point, and it can be very difficult to manage. And if you're already feeling overwhelmed and you're already feeling anxious and you're not sure how you're going to implement strategies, and you're not sure you have the budget for things, and you don't necessarily have a great support system, it can be hard to answer yes to that question, or they answer yes, but it can become evident pretty quickly that the capacity to engage in a process of recovery can be diminished, okay? But I can tell you that when people say no here, that's a drop my pen moment. Why would I move forward with the client if they weren't in a space of actual capacity to recover? That just seems mean, okay? And it seems like a good way of failing. And so I started asking questions like, because they do write this sometimes, no, I'm not emotionally capable. And I asked them, well, what's the biggest barrier to that? And that becomes the first step in their recovery. Whether it's something I help them with, whether it's like trimming the fat on the amount of doctors that they're seeing, whether it's getting them to the right therapist, whether it's understanding what's going on in the home and see if we can get a conversation going with the spouse so that the spouse is supportive, getting them on the calls. It's really tricky, especially when you're working with single people that have chronic issues, and especially when you're working with children. The child isn't going to be answering these questions anyway, but a lot of children are not emotionally capable of handling treatment, and they need parents that aren't just simply going to drop their child off and say, fix my child. They're going to need to be able to be the emotional support system for the changes that need to be made, and be able to emotionally offload their child and direct them into recovery. And it's not simple. Okay, why do you think healthcare practitioners have failed in your case? The number one reason people say here is because they feel like the doctors might have been experts in their field, but just weren't getting the full picture. That's the most common thing. Or they never really got to the root cause, okay? Or they're just really focused on one thing as far as the treatment, and their case is more complex. That's the number one reason people say there. So you see, these are personal questions. We're out of the medical questions, okay? These are more personal questions, because now I need to figure out how am I going to talk to this person. Everybody's a little bit different, and if I can craft a message that is relatable to that person, then I can be more effective at communicating. So rather than just communicate everybody the same, I try to do a little bit of an idea how I'm going to do that. Some people are more left brain, some people are more right brain, some people want me to be direct, some people actually want to know what could happen, some people want to focus on what will happen in a positive way if they do the right thing, some people want to know what will happen bad to them if they don't make changes. And so I have to kind of figure that out. If I miss the mark on that, I'll lose them for sure. Okay. Do you think your condition can be improved or cured? That's such a big thing. Most people that reach out to me will say yes. Okay. But let's say I'm working with somebody and they have like this kind of like presentation where they've had a stroke on the opposite side of their brain. There are people that have a belief that they could recover beyond the scope of what I'm aware of. And so I don't want to be the negative guy telling them they can't do it, but I also want to be realistic with them about what I'm offering them in terms of exploration of recovery. And so that's a really important question to answer. Most people are looking for at least an improvement, but let's say they have Hashimoto's, or they have like some psoriasis, or they have an autoimmune disease. That can't be cured. People are offering claims that those things can be cured online. I see this a lot, and you cannot cure those things, but remission is possible. Okay. I love this question. What are you looking for in a healthcare practitioner? Most people will tell me what they're looking for. They're looking for answers for what to do at home. They're looking for a diagnosis that makes sense to them. They're looking for a comprehensive solution. They're looking for a supplement that will work. They're looking for recovery from like rapid heart rate when they stand up, whatever it is. They're looking for somebody to be detail oriented. Okay. They're looking for a particular modality. And I can tell you, if they're looking for a particular modality that I don't offer, I can tell them I don't do that at that point, but these are the things I can do instead of that. Or that modality might work for you, but my experience is it may not work in step 1. That would be more of like a step 5 thing based on the variables that I'm seeing here. So, that could be a very useful conversation. Okay. Another great question. What things do you dislike about a healthcare practitioner? They'll tell you they don't like it if you're too negative. They'll tell you they'll tell me they don't like when doctors jump to conclusions. They don't like to feel judged. They don't like to be told it's all in their head. They don't like a doctor that's rigid and focused on one modality. They don't want to feel like they're being part of a protocol and not being seen as an individual, which is interesting because when I put together a detailed program for them, then they want to know what the protocol is, which is kind of a funny thing that I run into in practice. Okay, but this really helps me understand how I can communicate more effectively with them. They might say stuff like they over rely on portals and emails, And if they say that, I'm like, look, I'm not sure I'm the right doctor for you because I really rely on forms a lot. I rely on the portal. I rely on emails, communication. And it might be that you're looking for a different type of practice management style, and you could just find yourself agitated or irritated all the time here. And so we have that discussion. I've definitely seen that. Um, what do you consider a realistic window of time? I love this question. It's funny. Sometimes people will tell me like 2 weeks, 3 weeks, and that's realistic for some things, okay? But like if you've been dealing with something for 20 years, 15 years, it's not realistic, and they'll say like 3 months or 6 months. And I love this question because I can start getting a dialogue going. I don't think I can do it in 3 months and 6 months, but I can help you see changes, okay? But I'm not sure I can help you with resolution, all right? But I often come back to this. Let's say I'm working with somebody and then we're doing really well. This happened a lot during COVID, doing really well. Then they got COVID, okay? And COVID really whacked them. And so now we're basically restarting. So I'm working with them for a year and they give me 6 months, and I have to go back and say, look, I know we're a little outside what we had set aside in terms of time, but are you okay with this still? Are you okay with the process? Is there anything that I can do for you now that would make you feel really good about the process? How is it going? So that can be really useful. I also love this. How long before you quit? Okay, and people will tell me kind of the same as above, but I find that it's really interesting, man. Sometimes people will just disappear very, very, very quickly. Sometimes they tell me why, sometimes they don't. Um, and I think it's a really important question because actually I'm investing a lot of time in these cases. And if somebody just tells me they're going to quit in a month, I need to talk to them about it right there, because if it's going to take much longer than that and they're about ready to quit without any improvements, then gosh, they could be setting themselves up for some real problems too. Imagine you have one of those complex issues like the Rubik's Cube example, and so they have all sides of the Rubik's Cube are all screwed up, and I help them with one or two sides, but they have no changes in their symptoms. How do they know they're getting better? And I've seen people that will just quit because they have no improvements in their health, okay? But then they're gonna go to another doctor, and that other doctor is gonna look at one side, and they're not even gonna see where they need to go necessarily because they haven't looked at the full picture. And so now they're just gonna be jumping from one doctor to the next doctor, to the next doctor, to the next doctor, to the next doctor. And I'm just another notch on the belt, so to speak. And so that's why that question's in there. Okay, but look, you're welcome. If you need to find another practitioner, I respect that, okay? But I'm just saying it's kind of a tough crowd sometimes. Okay. What are your expectations from us? Most people will be very clear there. Some people will just say I just want to feel better. I want help with my chief complaint. I'm looking for a detailed report so that I can take this back to my insurance company and get some money back for it, hopefully, because your clinic isn't processing insurance for us. I would like you to take time to talk me through this. I would like to do this without supplements, that kind of thing. Is there anyone you blame for your health condition? Generally, I find that people that are blaming somebody else or something for their problem and haven't made peace with that will have a harder time recovering, especially if they're blaming themselves too. So there's just so many emotional aspects and so many programs that we can open in our head that are counterproductive for healing. And what I'm trying to do is figure out, do they have any of these programs open, and do we need to spend some time on that if we're not seeing the changes we're looking for within the time frame that they've given me here? These three questions are the most irritating questions I think that people get, and the feedback I get on these questions. How much money do you project in laboratory tests? How much money do you project in consulting fees? How much money do you project in supplement fees? I mean, look, here's why I ask these questions. If this person has a very complex case and they haven't done any of the labs yet, they haven't showed up with a stack of labs like this thick, and I haven't looked through them yet, and they're at the very beginning of this, but it's very complex, and they just haven't done the testing, there's some more boutique testing that I might need to do that will fill in the gaps. And if they've only budgeted $200 for testing, and I need to order a test right off the bat that's $400, I'm gonna fail with this person because I won't be able to get the data that I need. Furthermore, let's say they budgeted like all expenses here like $3,000 or something, okay? And we're like a year in, they're halfway home at $3,000. Okay, if I look at this case and go, this person has severe autoimmunity, they're on medications already for it, they have POTS, which means they can't tolerate gravity without getting a severe stress, they have a vaccine injury, and they're not digesting food very well, they have SIBO, you know, I don't think I'm going to be able to do that in 6 months, and I'm going to have to look at their budget and go, they might need intensives, they might need some labs. And so if I feel like their projections are light, then I'll just tell them then, okay? Because there's nothing worse, and I learned this the hard way earlier in practice, there's nothing worse than getting deep into a case with somebody and they're doing so well, but they just have so far to go and they've come so far and they just, they didn't allocate the resources for it. And so then they backslide. And that's a very sad thing to witness. So that's what these questions are for, to try to prevent that. It also helps me budget. I work with people that have amazing budgets that are just like, whatever you want, order it, okay? And then I work with people that are really tapped financially. And at that point, I might say, okay, this is what I can offer you with this budget. It still could be really helpful. Is this something you're interested in? Okay, and we have that discussion early on rather than later on after the fact when they're already stressed out and they're kind of like, well, we'll see how it goes kind of thing. It's really hard to commit to something, isn't it? If you don't know what you're getting into. And I think there's just not enough emphasis on helping people understand what they're getting into before they get into it, so they can actually make a commitment and they can actually engage in that collaborative restorative care where they actually take individual responsibility and can do it. Okay, so once they give me the budget, I ask, are you prepared to handle the costs? And so if they're not prepared, then we have a discussion about, well, what would it take for that? Not because I enjoy talking about money as a doctor, but because I don't want to fail with that person. Okay, do you feel our practice fee is fair and appropriate? A lot of people say yes, a lot of people say no. People that say no generally don't do well in my office, okay, because they already feel like they're being cheated. And so that's just an important question, and that at that point I have to have a conversation with them to see if I can figure out why that is and try to show them the value in what they're getting rather than just what the expense is, okay? That's why I asked that question. Are you emotionally and spiritually able to handle for the case management? It kind of goes into the prior question. How would you feel if you spent all this time and money and it didn't go well? Okay, that's an important question in terms of like, again, I want to prepare people for the idea that this might take longer than they're expecting, especially if they have a chronic case and nobody's been able to help them. So I need to know how they're going to respond. Now, most people aren't going to be able to know that. So, but the thing is, if they start having problems, I can refer back to this and go, this is why I asked this question. Do you remember the discussion we had? Okay. Is there anything else you should tell me? Isn't that funny question? Hey, is there something you should tell me that you're not telling me? But I get some really, really interesting stuff there in terms of like, oh, I forgot to tell you that, I was in the hospital, or I was at the bedside of my father when he passed away, and that had a profound experience. And so they'll tell me interesting things that just didn't come up in other questions, that can be extremely, extremely, extremely helpful. Some people tell me about dreams they've had. Some people will tell me about what their future goals are. It's pretty cool, okay? And that helps me formulate a more comprehensive message. Is there anything in your belief system that may be holding you back? And some people will say, yeah, I have a strong problem with authority. If I attach you as an authority figure, I'm going to rebel against you. I've literally had another doctor say that to me, who was my client, and it turned out to be true. They will tell me like, I have a strict regime with my diet, and sometimes I wonder if it's the best thing for me, or I'm worried that maybe me being vegan isn't helping me at this point. That kind of thing. Then I ask, is there anything you're willing to change? And so like people will often say, yes, of course I'm willing to change, okay? But when they answer that question, they don't realize that like it's the stuff they're doing every day that is most likely to be contributing to the environmental activation of genes that are pro-inflammatory. So like the holy grail of that, whatever food they love or supplement they're attached to or exercise they're attached to, or like amount of screen time they're on, or whatever they're doing consistently, some of or many of those things might actually be, unfortunately, might be helping them cope, but it's counterproductive for their recovery. And so they'll say yes, okay, but you know, gosh, it can be really hard when you're already anxious and tired and fatigued to take on a new change. And like if you believe that CrossFit is your thing, and I say that CrossFit isn't going to work for you, and it might be years before you can tolerate that type of activity based upon where you're at right now, I need you to stop doing that if you want to recover. That can suddenly be like, you know, slaying their sacred cow. So it does happen. I do see people that are very attached to keto, very attached to being vegan, very attached to being vegetarian. And I just say, look, if those are things that you're a hard no on, I'm going to do my best to try to make these other systems work for you, but it might become a problem for us, okay, in terms of your recovery, if we can't find a way to help your body compensate. Are there any emotional experiences? Okay, so we kind of talked about this, but a lot of people have high adverse childhood event scores that causes neuroinflammation or vulnerability. A lot of people have been sexually traumatized or physically traumatized or neglected. They have parents that are narcissistic and you know, maybe were doing the best they can but fell short for what their child needed. And so those things can be significant. People that don't have a distinct purpose tend to have a harder time. I found that. Okay, that makes sense, right? This gets kind of into the early experiences question, but some people will talk specifically about a divorce or eating disorder that they developed that didn't come up earlier, which becomes important for me. I got to tell you, when I do a case review with somebody and their spouse is on the call, I feel much better about their case. I know it's a lot to ask to spend like an hour and a half on a Zoom call, but if it's not you, okay, but if you're able to be there for your spouse, at least at the very beginning, so that we're all on the same page, it's like super, super, super helpful. And I can tell you it becomes very, very, very difficult, obviously, if like you're being undermined by your spouse, if they don't believe in what we're doing, okay? Just very, very difficult, especially if they don't want to contribute financially, or they are contributing financially, they just don't believe in it. It's going to be awfully tough to succeed. Are your spouse and your family unit supportive of seeking care? Okay, so I kind of got ahead of myself. That was the last question. I got to tell you, like, are your family unit supportive of you with your health condition? So many people live with spouses that don't believe them too. They're just kind of thinking, listen to your doctors, and the doctors didn't help them. So now they're kind of hands in the air. They don't know what to do either. And they might be blaming their spouse for lots of things instead of like being supportive. And I'm not trying to take sides here, but that's a tough environment to heal in. Okay. And then the last question is, how do you feel about answering all these questions and the case review process? And a lot of people will tell me they hated it. No, I'm just kidding. A lot of people will tell me they actually really liked that I was this thorough, that it was cathartic for them in many ways, that they appreciate the fact that I wanted to look at all this stuff, and they're feeling confident and hopeful because they're now being able to see how everything's go together. They never did that before, so that's super helpful. And some people say that it was taxing and they didn't like it. Some people would tell me that they think it's pointless because most doctors don't look at it. I've had that happen a couple times. So that's the case review process, and that's something that I tend to reserve for really complex cases, so that I can create a model that catches those people that are falling through the cracks of the standard and the alternative model. Okay, I'm not going to spend too much time on the next form, but let me just get into one more form. Okay, because remember I said that the battle here is to do a detailed history do forms that help me identify issues. And then the next step is to do an exam or to do some sort of like lab test or diagnostic to objectively quantify the physiological process that's happening here, okay? And so once I do that, then that becomes the measurable testing that we can hang our hat on, so that if like a person isn't feeling better right away, I can say you're 60% improved on this particular marker. We just need to keep going. There's two kind of like, there's many different ways a client can present after we start working together, but two common scenarios are like they feel amazing like really quickly, and I'm like, this is awesome, okay? Of course, they feel great. They're like 90% improved or better very, very quickly. And I'm like, okay, but you know, we still have these 5 other variables to go that are hanging around. So although you're out of the symptom zone, there you could slide back to this very quickly. So we really need to keep going with this lifestyle change so that you get the lasting change. The other side of that is I see people that sometimes work for years at something. I'm talking years, okay? And that doesn't mean I see them every week, okay? But they're working on stuff for quite a while, months, if not years, and a year or more. And the labs are showing real good progress. The exam is showing progress, but they don't feel any better, okay? And so that tells me that's what's left on those diagnostics that are there are going to be the last step, okay? Or it tells me that there's maybe something that we haven't accounted for that is making them still feel lousy. So it's nice to have the objective data so that we don't call it off too soon and they end up right back where they started, or that we can have a way of figuring out what to do next and where to go in a more objective way, rather than just relying on symptoms that may not change, okay? That's how we kind of start working through that Rubik's Cube of a complex case. I'm gonna go through one more form here, and then I'll take questions, and then I'll go through my offer at the very end here. So let me share screen again. Let me get this up. And so these are kind of the forms that I use if I'm not doing a case review, just kind of a more system survey. I'll include these as part of the case review, but if I don't do a case review, this is more of like a general assessment with people. And so basically, I'll just cut to this part here. The family history is obviously very important. The diet's very important, okay? The 5 major health concerns, okay? But each one of these categories represents a physiological system. So category 1 is like the large intestine, okay? Category 2 is the small intestine. Category 3 is chemical tolerance, right? So just very quickly, let's say like I have a person who worked as a, like I had one patient who had multiple sclerosis that worked in mosquito control. And there was some concern that maybe the mosquito chemicals had contributed to some neuroautoimmunity. And so when we look at his case review, yes, he had all this environmental exposure. And when we look at his neuroinflammation on these forms, yes, he had neuroinflammation. But when I look at the chemical reactivity, he's not showing a lot of chemical reactivity. Okay, so I may not be thinking that it was an environmental toxicity that drove that, okay? So this is where I can start to decide what test am I gonna order, okay? Let's say I saw that MS patient and they had their mercury fillings taken out and they got a significant exposure to mercury vapors, and then like 3 weeks later they had numbness and tingling, and like they had bowel and bladder control issues, and they have constant skin outbreaks, they had like weird smelling sweat, and they have now they can't walk through a grocery store without reacting to that. That person may have a loss of chemical tolerance, or say they react to their earring or their bracelet now. They start getting inflammation from it touching their skin. That person may have a chemical reactivity. They actually might need a chelation, at an acute chelation center, not in my clinic, or they paradoxically could fall apart with chelation because it's more of a chronic issue and they've lost immune tolerance to things. So you can see that with these forms, I can very quickly get a view of subjectively where people are at. And then, so for like the large intestine, I quantify this objectively, if they have all a bunch of symptoms here, I might do a stool test with them. I might refer them for like a colonoscopy. I might do like a blood test with them to see if they have any evidence of bleeding. I might do like autoimmune testing to see if they have Crohn's or ulcerative colitis. There's a number of different things we can do to look at the large intestine objectively. But let's say they have a bunch of symptoms in the large intestine, but then objectively there's nothing. Then we could probably say the large intestine symptoms are probably secondary to something else, all right? So let's say I saw this person with like severe constipation and we do a stool test with them and their stool test comes back with a parasite that they picked up probably when they went to India or something like that, or they went to Mexico and they got Montezuma's revenge and it resolved out of the symptom phase, but it was still living there, or they have like C. diff from being hospitalized, okay? And we address that, however we do that with the referral or something in my office and that resolves, then great. Okay, but let's say that same person has all these large intestine symptoms. We run diagnostics on the large intestine and nothing comes back, okay? But then we go a little further and we see that, oh, that's the person that had hypochlorhydria or low stomach acid production. That low stomach acid production was allowing them not to digest their food very well. That undigested food was matriculating to their intestine where they had all this bacteria, and the bacteria was eating the undigested food and creating chemicals that were inflaming their intestine. Although it wasn't bad enough to show up as polyps on a GI study or showing up on a stool test, they clearly had IBS and it was related to food, but secondary to the hypochlorhydria. And then now we're off to the races figuring out where the hypochlorhydria came from. Is it the H. pylori? Is it because they were drinking too much water? Was it secondary or primary hypothyroidism? Was it a vagal issue? Do they have a nutrient deficiency where they're not making enough stomach acid? Are they not making carbonic anhydrous? Anyway, we go through this process, right? So that's what these forms are. These are just different categories and we can objectively quantify all of these things. And I tend to look for things that are like 2s and 3s, and things that are a lot of 2s and 3s. Those might be the things that we quantify first, okay? If everything is 2 and 3, then I have to rely more on history and more like comprehensive testing. Whereas if the couple categories are just 2s and 3s, then I might do more specific testing for that, okay? This would be a pancreatic issue. So a person could have a digestive issue coming from the stomach up here. They could have a pancreatic issue causing that, which looks slightly different, okay? And then this would be SIBO. So this would be a small intestine issue. This up here is the small intestine, okay? But if there's small intestine, oh, sorry, that's the large intestine. This is the small intestine here, okay? Unpredictable food reactions, aches and pains, swelling throughout the body. But if they have those symptoms and they have SIBO, then is the small intestine issue from an overgrowth of bacteria, you see? So there's kind of this hierarchy of systems that I have in my head. And the way it's laid out in my head is there's kind of a left side and a right side. Things on the left side take priority that cause the things on the right side. And then we're basically relying on objective data to figure that out. This is the Atlas method. We take a deep history, including forms. We run objective data to quantify the symptoms that are subjectively reported on these forms that come up with history. And then based on the objective data and based upon the severity of responses, based upon the hierarchy of systems involved, based upon the client's level of investment, commitment, and interest, we intervene. We either go really aggressively or we go more conservatively, and we create this formula of variables and we try to solve for each formula with an intervention, but it's like long division. The first variable hopefully takes care of a lot of the rest of them, okay? And then there's a remainder, and then we take care of what's remaining. And we just keep going until the person's got to a quality of life where they feel like they're out of the symptom phase and they know what they can do to maintain that, or until we hit a wall and we need more diagnostics or some sort of referral, okay? Okay, there's the SIBO. This category is the gallbladder. This category is the endocrine. This is the exocrine function of the liver. So this is gallbladder and like how the gallbladder works and how the liver makes fat and makes protein. Okay, and then this is how the liver detoxifies. So a lot of people here will have these hormone problems and they're like, oh, I need a detox. Okay, but up here, their whole liver is all screwed up here too, they probably have a liver problem. They don't have a liver detoxification problem. Those are separate issues, okay? Category 10 is a blood sugar problem. So many people I see have energy crisis, and like the foundation of healing is the ability to make energy. And so if you have an energy crisis due to like dietary habits that aren't serving you, our work becomes much more complicated. So when I see people that have 2s and 3s on this section, I know that unless I help them with that, we're gonna fail. This is insulin resistance. So rather than reactive hypoglycemia where a person gets energized after they eat, okay, they actually get tired after they eat. Okay, and so there's a number of different things here with blood sugar that become staples of the recovery process. This is low adrenal function. This one here is high adrenal function. This is, down here is hypothyroidism, okay? And then so many people have all the symptoms of thyroid disturbance, but their lab tests are normal. My colleague, Datis Karazin, even wrote a book about that. So they have all these symptoms here, even though they're on thyroid medication. So we need to work with some of the secondary causes. This is hyperthyroid. This is prostate swelling. Okay, this is like andropause or estrogen dominance or low testosterone in men. We get into some of the estrogen dominance and progesterone issues in women here. And then we get into the menopausal version of that. Okay, women that go into menopause and are falling apart, generally the hormone drop is causing an immune reaction, which is activating vulnerable systems into inflammation. So we need to address the immune and inflammatory issue, not necessarily only do hormone replacement or refer for that. There's so much more involved with that. As most of you know somebody who's done hormone replacement and it didn't work for them or only partly worked or only worked for a little while because generally there's a deeper issue there. This gets important. People that fall apart with alcohol or people that are drinking more than what their body wants may not recover. Same thing with coffee. A lot of people that eat out are getting a lot of sodium. Sodium tends to drive autoimmunity, bananas. Okay, also it's unlikely that they're getting food that's cooked on, a lot of that's cooked on a non-stick surface, a lot of that's fried, a lot of that has extra sugar in it to make it taste good, a lot of it has MSG. So I know that they're probably not getting necessarily the best food quality if they're eating out a lot. Raw nuts and seeds are important for the brain. Roasted nuts and seeds are oxidized fat, so you lose some of the nutritional value there. I got some feedback on this form. People would like me to say, instead of the worst, maybe the least healthy foods instead of the worst foods, but basically that's what I'm trying to get to there. Sometimes people tell me like Oreos and like potato chips, but then sometimes down here on the healthiest foods, people will tell me fish sticks and like bottled water or something, you know what I mean? So sometimes what people think is healthy isn't, and so there's just a lot of education that goes into being a collaborative approach. Obviously stress levels are important. People that are stressed 10 out of 10, I need to talk to them about expectations. It's really hard to recover when you're in an active stress response for a chronic issue in particular. Okay, maybe not so much for a sprain or some pain problems, but chronic pain, it's very difficult to come back from if you're stressed out of your gourd. Okay, some people never eat fish, have fish allergies. They're not going to get enough anti-inflammatory fats that way, or the only fish they eat is like broiled or fried. A lot of people, it's funny, like I had a patient the other day who said they haven't worked out at all in 3 years. And that was just kind of normal. And I'm not making fun of them, obviously, but it's just like, it just goes to show you how quickly this stuff can like get out of hand. Obviously, moving to the body's capacity and slightly past it, it's a part of hormesis and stressing the body into a change, and it can be very difficult to help people that are not working out that can work out, but also people that need to take a break that are working out compulsively might need to take a break. So that's an important question. We've gone through the medication and the supplements. The dietary thing's super important. A lot of people don't remember what they ate. That's a key thing. A lot of people are eating the same thing every day. That's a problem with oral tolerance and novelty and the microbiome. A lot of people are skipping meals when they haven't got themselves in ketosis. And so if they're not insulin resistant, the intermittent fasting is not working for them, it's working against them. So you can see like, oh, are you willing to make any changes? They say yes. Then I'm like, oh gosh, that blocked fast that you're doing is actually part of your reactive hypoglycemia, which is creating the energy crisis, which is not allowing you to heal on that first step. And suddenly the thing that they've been attached to, now suddenly they're being told that it's wrong. And that's why that question becomes so important. These are just medications that have caused problems for them in the past, potentially. It's stuff they've taken. And then the rest of this is basically, these are lobes of the brain function assessment form are lobes of the brain. It helps me understand where I might need to do brain therapies with them. But instead of doing labs to quantify this, what I would do is, like, for example, this section here, section 2, is related to something called the substantia nigra. So when I see people flag on this, that's like a pre-Parkinson's presentation, okay? And Parkinson's symptoms will show up 20, 30 years before Parkinson's. If I see this part of the form active, 2s and 3s, and then I see like loss of sense of smell, difficulty sleeping or fitful sleep, constipation, voices become softer, episodes of dizziness, a little hunched over when they walk. Also, I could add shoulder and hip pain that just isn't going away, stiffness, and then they get up and move, and it goes away then. Those are really early indications of a failure of this area, which could progress to Parkinson's. So when I look at their exam and I see loss of smell, and I look at their exam and I see range of motion issues with their shoulder, and I look at their exam and their face is like kind of like angry, and I look at their exam and I see like square wave jerks during the eye movements, and then I do stuff and I help that area work better with their brain with exercises, like brain exercises, and they're no longer constipated and their sense of smell is normal. They no longer have square wave jerks. They're not hunched over in their posture, and their shoulder and hip pain have gone away. Heck yeah, dude. We basically may have helped them outlive Parkinson's. This is what I'm talking about. Prevention is available to us if we just pay attention at the very beginning. Okay, a lot of people come in with shoulder, hip, like knee stuff. They don't realize that it's a part of a brain problem. And so I have to help show them that. So that's why they can understand why the PT or the other chiropractor didn't help them, because there's a top-down component, okay? So that's what these brain function forms do, is it helps me understand what exam findings are correlated more to their symptoms. And then this form here is more looking at brain health nutrition assessment. So this is like the neurochem. Sorry, I don't mean to scroll so much here. But this is the neurochem form. And the neurochem form is basically looking at neurotransmitters. Here we go. Neurotransmitters, blood flow to the brain. Okay, if a person has that blood flow to the brain, they're not going to be able to heal their concussion or their neuroinflammation, which might be the cause of their vagal issue causing their acid reflux. Okay, I know I said that fast, but I'm getting towards the end of my time here with you. I promised I would finish in 2 hours. So these forms, again, this is like how a blood sugar issue can cause all your brain symptoms. Feel energized after meals, energy drops in the afternoon, crave sugar and sweets in the afternoon, wake up in the middle of the night. How many people wake up in the middle of the night and they've been on sleep medication for years that's disrupting their memory and not fixing the problem, and they're on their way to dementia because of it, when they've had a blood sugar issue their whole life and nobody actually sat down and worked through it with them. So that's what I'm offering here. That's what the Atlas method's all about. Okay, so I'm not going to finish this form. I want to get into the offer, just to kind of rehash this. The lost art of medicine is taking a comprehensive history, so that before we intervene, we kind of know what the lay of the land is, the map, so to speak. Atlas Health isn't the top bone in the neck. It's not actually the person holding up the world in the mythological sense. It actually is a book of maps. And so, like, where are you in reference to your target? And what are your goals, and how can I help you get there? Not from the idea that you're broken, but that your body thinks what it's doing is appropriate, and how do we make what you want to be appropriate? Okay, what are the things that you're doing that are contributing to it that might need to change for a lasting change, or to even get out of the symptom zone? What are the things that I can help you with? How do we quantify those things? How do we intervene? For how long? How much might that cost? and who else might we need to include, or who might we need to cut out in this phase so that you have the proper capacity. I often see cases that I fail with are because, and let me just be real, like I fail with cases, okay? I succeed a lot of the time. I also fail a lot. And one of the reasons I fail, and I fail less than I used to because I do this case review, but one of the reasons I fail is because they're seeing like way too many doctors, okay? They're implementing way too many care plans at once. And so one of the things I need to try to do with them is get a commitment to a care plan that they can stick to, and that we can kind of focus on a few variables instead of like running all over the place, okay? If we can identify the basic cause or the complex web of cause, okay, that's the first step. Then I need to help you believe and understand and collaborate with what we're going to do, develop faith, confidence, and belief of what we're going to do. Then we develop a remedy. And that remedy has to be something you agree on, kind of understand a little bit, maybe not the complexity that I do, but could be helpful. And then we intervene based upon the hierarchy of systems. So the base intervention has the greatest chance of helping the rest of the interventions. And we do this in a stepwise fashion, okay? One of the things that I try to get away from is working, see you next visit, see you next visit. You might have noticed that I try to talk to you about, hey, we might want to schedule a few of these out so that we have the time that we need, because I anticipate we're going to do that. And some people are cool with that. Sometimes for reasons I don't quite understand, I get a lot of resistance to that. But the idea is we want to have everything in place so that we can get through that container of that first phase of care or second phase or wherever you're at to actually heal and recover. Once we get to the recovery phase and you get out of the symptom zone, the next step is, if you're into it, we try to help you optimize or help you make that a lasting correction at the very least. And optimization may include things like prevention, looking at forms and seeing those symptoms are now off the table, so you can outlive things like dementia, you can outlive things like cardiovascular disease, you can outlive things like just being stuck in your house because you're tired all the time, you can outlive things like cancer, okay, which is super cool. So, thank you so much for your time today. For those of you who stuck around, the offer is, the case review. It takes me about 2 to 3 hours to go through all the documents, including, because people submit a lot of labs because they've seen a lot of different doctors. And then I type up a summary of that case review before I meet. And then I go through my summary with the person for about an hour to 90 minutes on a Zoom call. And at the end of that Zoom call, I type up another summary that summarizes the case and then what we talked about in terms of what we're going to do to line up the recovery. So that process can take me anywhere from like a few hours to like 5 hours or more. And right now I'm charging $2,000 for that. And so my offer is, if you have not done a case review, would like to do one, or you have a family member or a friend that's a close friend that has been really struggling and is looking for a comprehensive approach, I'm offering this case review for $1,000 instead of $2,000 for the first 5 people that say they want to do it. So all you have to do is, reach out to our office, 415-459-4411. Let us know that you want to do that, or shoot us an email. That's contact@atlashealthmethod.com, and we're happy to honor that for you. But we have to the end of the week, and then we're kind of on to the next thing. So if you get back to us by Friday, then that's cool. I'm really looking forward to serving those people. I really appreciate your time. Do any of you have any questions? One of the questions is, where do I draw the line between working on the brain versus working on the brain with a psychiatrist? That's a great question. So let's say this actually happened to me working with a child. One time I had a person bring in their child for an evaluation for a behavioral issue, and they thought maybe they were on the spectrum, oppositional defiant. And so let's say like you have a frontal lobe that isn't developed, you're going to have a problem with impulse control. So seeing a chiropractic neurologist and getting exercises to beef up that part of the brain can help with impulse control. What was interesting is I went through this entire exam and I didn't see any evidence that this child was having a deficit in their brain. And I just looked at the mom and I said, "Are you adopted?" And the mom was mortified. Okay, but I just had this sense that there was an attachment issue that was playing out there because the child only acted out when they went to school. and it was only a certain thing, and it only lasted for a particular period of time. It wasn't across the board on the history. It was just one particular circumstance, and it was usually when the mom dropped the child off, not the dad. So that person was kind of mad at me because I wasn't able to write up a report that helped this child get special accommodations for things and like government assistance. But as it turns out, it's what it was. So that child and mother needed to do like some sort of counseling together that was beyond the scope of what I can treat, but she didn't believe me and was pretty mad at me. She went to her psychologist, and the psychologist said, I don't know who this chiropractor thinks he is, but he's right. Okay, so that was cool, not for the validation for me, but that person was in the right spot with her daughter to get the right therapy. When I see, this is such an important thing, so much of what I see is a compensation structurally, if they're stressed out and they're not processing their life well and they're stuck in stress posture, stress chemistry, they're going to have more orthopedic issues. Just everybody go like this one time and then lift your shoulder and do it again. Okay, it's a lot harder. So if you're a little bit stressed out, you're more likely to have a shoulder injury, right? So there's a biological process of stress and stress resiliency, and then there's a psychological process. So the people that are doing body work and doing like functional medicine often aren't working on the psychological aspect. Okay, so that's a problem. And then you have people that do the psychological aspect, but they don't really understand like how a thyroid issue necessarily can cause them not to be able to recover in their office, or they might not understand how a brain injury is influencing their memory. And if their memory isn't good, they're not going to be able to develop a new relationship with this trauma and remember that it didn't happen to them now and then recover. So I think it's a really important question. And how I discern is their history. What's their response to therapy been if they've gone? And then let's say they go to the right therapist. They go to like a somatic therapist and they have more of a right brain issue and they were at the right spot, but it just didn't work for them. Then maybe they have a severe inflammation and they have a brain injury, and that's why that therapy didn't work, even though it worked for so many other people. Or let's say they had a left brain dominance and they went to talk therapy. It probably didn't work for them because they needed a therapy that was a psychological intervention that was going to work more for their right brain. When I see people that have more like obsessive compulsive issues or anxiety issues or attachment issues, or addiction issues, that involves a part of the brain called the basal ganglia. And if the health of the basal ganglia is not good, it's going to be, if it's inflamed from like a herpes 6, HHV6 infection or Epstein-Barr infection or an autoimmunity like I had from strep, okay, they're not going to respond well to therapy, okay? That being said, if all I do is help the function of their brain, but they still, let's say they now have the capacity to respond to something. Their frontal lobe is online. Their processor is now working, okay? Their basal ganglia is no longer inflamed. They passed their exam for the basal ganglia. There's no more exam findings. But situationally in life, they're not able to choose a different path. So now the choices they make are based on like prior experience, and they're not like choosing to stop smoking, or they're not choosing to stay away from porn, or they're not choosing to be curious about life instead of like expect a bad outcome, okay? Or they're still choosing like toxic partners, okay, because they're addicted to stress chemistry. Like they may have the capacity now to make a different choice, but they might need to see a therapist to help them with tools to now navigate to that new part of the brain. Things like hypnosis, things like EMDR, things like transcranial magnetic stimulation, things like somatic re-experiencing, family constellation, talk therapy, right? Psychoanalysis, dream analysis. Some people have psychedelic journeys, and that can be useful. So the idea is like, I wouldn't send somebody to a therapist if they were anemic and had a concussion, were neuroinflamed, because I know that their brain really doesn't have the biological capacity for much stamina. I might work with them on that first. If working with them on that first doesn't improve their anxiety by itself or improve their depression by itself, and I talk to them more and it seems like they want to do something but are having a hard time doing something, or they keep doing the thing they know they don't want to do, or they're struggling with like a trauma. At that point, if their exam's looking like they're ready, then I'll send them to a therapist. So I think that's an awesome question. That's how I would answer that. Does anybody have any other questions? Hey, it's 8:03. I know I went over a few minutes. Thank you so much for your time. If you have any other questions, just go ahead and email me at contact@atlashealthmethod.com or send us a voicemail, 415-459-4411. I'm really looking forward to the next one. Our next module, I'm going to dive right into how we objectively measure some of these history findings with diagnostics and with exam. The module after that, I'm going to be getting into lab testing and how we can quantify those forms with labs, okay? And then after that, the next phase, I'm starting to get into different treatments. So I'm going to talk about exercise as a treatment. I'm going to talk about brain therapies as a treatment. I'm going to start getting into all these different modalities like PT and OT and chiropractic and extremity adjusting and spinal adjusting and rotational therapy and like all these different therapies and where they fit in this world of receptor-based modalities that are going to influence your health and vitality. Then I'm going to start getting into supplements. Then I'm going to get into diet and different diets. Then I'm going to get into like neuroinflammation and neurology specifically. Then I'm going to get into autoimmunity. Then I'm going to get into cancer. Then I'm going to get into like diabetes and things like that. I'm going to start getting into the emotional side of things and different things that influence the emotional side of things. So I'm really excited about this series. I'm looking forward to seeing you on the next one. And so thank you so much for your time. We'll catch you later.